Hello everybody, I'm Dr. Venu I am one of the vascular and endovascular surgeons from Star Hospital, Banjara Hills. Today we are going to briefly discuss about varicose veins. So what are varicose veins? They are nothing but dilated tortuous veins which one can see on the lower limbs. They are very common. Most commonly they occur in patients whose profession involves long standing, like teachers, like police person, and like barbers. All these professions involve prolonged standing. When that happens, these patients develop what is called as dilated veins, which can lead to varicose veins. In few of the patients, they are hereditary in nature, in the sense that they run in families. I do find a lot of patients saying that my grandfather, my father, they all suffered from varicose veins. So this can run in families because of hereditary nature. So what are the symptoms with varicose veins? Most of these patients, they don't even know they have got varicose veins. They are not aware of the problem at all. They are completely asymptomatic. In some patients, they complain of dragging pain, especially prolonged standing. Especially once they come home and sleep, they get cramps in the calf muscles. Some patients complain of swelling. In few patients, they notice a change in the color of their skin. So there are lots of presentations. Some patients present with itching, eczema, dermatitis. What is called as lipodermatosclerosis is a medical term which say basically because the skin changes associated with varicose veins. So what exactly happens in varicose veins is that the veins, the bad blood, the deoxygenated blood, usually it goes from our legs to our heart in one way direction, and there are some very delicate specialized valves which control this one-way flow. In patients with varicose veins, these valves, they don't work properly. That means the blood, instead of going back to our heart for purification, some of which will come down. There is a reversal of these blood. So once this reversal of deoxygenated blood happens, because of the gravity, all the blood gets stagnated around the ankle region. So once all this venous blood, the blood in the veins, get collected around our feet, this can cause irritation to the skin. This can cause blackening of the skin, like skin discoloration. All these changes, we call it a term lipodermatosclerosis. And these patients have got very itchy skin, and once they start itching, can lead to what is called as varicose ulcers. Once varicose ulcers form, it can be very difficult to treat, causing increasing morbidity, and patients are really suffer from it because the surrounding skin is not as healthy as the remaining skin because of the effects of these reversal of venous blood around the ankle. Few patients, they present in an emergency with sudden blush of blood coming through the varicose veins. The blood in the varicose veins is under very high pressure, so they can bleed quite a lot, and it's quite scary, understandably, for the patients with bleeding episode. So these are all the various presentations one can present with varicose veins. Is it dangerous? Patients do come to my clinic, doctor, somebody told that I will have heart problems, it should be operated immediately and it's very dangerous to heart. I would like to reassure today is varicose veins, they are not an emergency at all in terms of any cardiac risk. There is no need to rush into treatment. It is one of those conditions where it can lead to morbidity rather than mortality, I would say. So I would like to reassure most of our patients that treatment is not an emergency. If it is bleeding, I would recommend to put their leg elevated and put some pressure. Most of this bleeding will stop eventually. So can we treat these varicose veins at all? Can we manage these varicose veins? Is treatment mandatory for everybody? It depends on what stage they present. It depends upon what their symptoms are. Most of the varicose veins, they don't need any surgical treatment. Most of these patients need reassurance. They need some stockings. The reversal of blood needs support. So wearing compression stockings, usually we prescribe what is called as class 2 compression stockings. Only below knee compression is enough, just because the effects of the varicose veins are around the ankle and in the lower leg. So as soon as we give support to the calf veins, they will feel symptomatically lot better. Suppose if patients regularly wear stockings and if their symptoms are getting better, but sometimes it can be quite difficult for them to wear stockings every day, and it can be quite cumbersome. In those patients, and in say patients who are young, we do offer what is called as endovenous laser ablation of these veins. It's a laser treatment wherein we put some small local anesthetic, we scan the veins, and then we treat entire veins using laser, so that the blood doesn't come down, the reversal of blood flow is stopped. And the deep veins are very important in carrying this blood back to our heart. So we always need to assess deep veins whether they are good enough before we treat varicose veins for the superficial varices. To just summarize about varicose veins are very common. Not everybody needs treatment. There are some complications with varicose veins which are treatable. Always wear stockings, whatever. If you find relief with stockings, but for some reason if you are not able to wear stockings for longer term, surgical treatment in the form of endovenous laser surgery or radio frequency ablation can be the answer. Thank you.